I will look at yet another issue as related to the upper limb, and this is what is known as scapular prominence. So when they say scapular prominence, they simply means what? One of your scapula, there's a way it is protruding back. Okay, there's a way it is showing itself, literally, you know. So scapular prominence, we said that it just refers to the shoulder blade and it's sticking out abnormally from the back. So they often call it the winged scapula, you know. So it usually results from muscle weakness, imbalance of the muscle, or nerve injuries that affect the stabilizers of the scapula, you know. So most commonly the serratus anterior and the trapezius. So what does it look like? We said that a medial border of inferior angle of the scapula protrudes outward instead of lying flat against the rib cage. So it's more noticeable when pushing against the wall. So you tell the patient to actually push against the wall. So the force will now, you know, the shoulder, it actually shows very much more well. So most of the times it's occurring on one side, or it could actually occur on two sides, you know. They call it a winged scapula, you know. So that's what we got, you know. So you see this test where you tell the patient to actually push against the wall, you know. Okay, so common causes could be due to injuries to the nerve. That's the long thoracic nerve that supplies the serratus anterior muscle. It could be spinal accessory nerve injuries that's affecting the trapezius. It could be the dorsal scapular nerve injuries affecting the rhomboid. So sometimes it's muscle related issues like congenital absence, you know, traumatic avulsions, or muscle imbalance due to poor postures or overuse. So structural and orthopedic causes could be due to scoliosis or kyphosis. Okay, that's like more of like their complications. It could be fractures or osteochondromas, and it could be soft tissue issues like all those scapulothoracic bursitis. Okay, so right. So symptoms is shoulder weakness. So if you tell the patient to do all those overhead activities, they are weak, you know, pain or discomfort in the upper back. Cosmetic concerns, the person don't actually like the way they look, you know. Also difficulties in maintaining normal shoulder mechanics. So you diagnose it from physical examination, imaging, and electromyography. Okay, so you manage all those physical therapies. You treat any underlying issues, you know, underlying nerve injury, muscle imbalance, skeletal deformity. They also brace and you support. Okay, so that's what we got for this, for the winged scapula.